Hello, this is the lecture on what happens to us as we get older and some of the changes that take place as we age. And we're going to focus on the biological aspects in this lecture, and then I have another one that we talk a little bit about social psychosocial changes that take place as we get older. The reason that we do that is because most of the folks in long-term care are elderly and about an average age around 85, and it's important that we have some understanding of what happens to us as we get older so that we can build and maintain environments of care that take into account those changes that do take place. So we'll start with skin. As we get older, our skin becomes more dry and flaky, less elastic, thin, very fragile. The nails become tougher, brittle, and thick. Obviously have more wrinkles, and this happens to all of us as we age, but lifestyle also has an effect on these changes. And we'll see that in just a moment in terms of smoking, for instance. But the reason that we're talking about skin in this situation is that if we know that the skin becomes more fragile, we need to make sure that the environment of care that we provide does not have any dangers that would damage the skin. For instance, any little sharp corners, a lot of tables, just Formica tables that have come to kind of a sharp point, can cause a huge skin tear if a person just rubs their arm up against that sharp point. So we want to make sure we have rounded edges on tables and not any sharp edges in the environment of care. Now think about the environment of care as we go through this lecture, because when you are working on the assignment of creating an environment of care in the dining room assignment, you need to be thinking about these issues. Think about them each of these changes that we're looking at. I'll explain that a little bit more for that assignment, but just keep that in the back of your mind as we go through this. Okay, so here's an illustration of the effects of aging on a smoker as opposed to a non-smoker. The person down on the bottom is a young lady at the age of 20, and as she ages as a non-smoker. The top series of pictures is the same person, and how they would age if they smoked over those years. Drugs also have effect on us as we age, an even more dramatic effect than the effects of smoking. Again, the person in the middle is a 20-year-old, and this is her at age about 50. The person on the left is a person who's not on drugs, and the person on the right would be somebody who is addicted to meth, in how they would be affected by those drugs. So, we all age, and who do you think this is at age 67? Well, if you guessed Jay-Z, you were correct. Here's a picture of him at age 38 and another picture of him at age 67. I have a series of pictures like this that illustrate the fact, again, that we all age. They're done actually by a person who has her doctorate in biology and a Master of Fine Arts in and she is able to pretty accurately picture what people would look like in advanced ages. Okay, hair changes. Hair strands become smaller and have less pigment. They turn gray or white. About a quarter of men begin to show signs of baldness by the time they're 30. So, aging starts at a pretty young age when we think about it. Some of the effects of aging, both in hearing and things like our hair, we can see the effects of aging at a pretty early age. Women also develop a typical pattern of hair loss as they age. Hair becomes less dense all over. Scalp even may become visible. I have an elderly great aunt. It's actually my father's aunt. She lived to be 106, and her hair, her name was Goldie, and she always had red hair. And she had her hair done even at age 106. But it was just kind of a wisp of hair. You could see her scalp under her hair. So who is this at age 78? You can see the definite signs of baldness there, hair loss. But even at a younger age, he had some hair loss. This is Mayor Giuliani, Mayor of New York during 9/11. Okay, so let's go to changes in sight or in vision. Typical age-related changes. There's a yellowing of the cornea, and you don't see color quite as well, and things tend to have a bit of a yellow tint to them. There's an increase in the size and density of the lens. There's a decrease in the size of the pupil. There's an atrophy of the ciliary muscle. I don't know if you know what the ciliary muscle is, but it's that muscle that allows your eyes to adjust their focus. It's like the automatic focus on a camera. Things far away, take a look at it, look off in the distance, and you can see things clearly if you have normal eyesight. And then if you need to read and you hold something up close to your face to read it, your eyes just automatically will focus on that print that's up close. Well, ciliary muscle doesn't work as well when you get older, and that starts to affect us even at like age 40. And we find that we need to use bifocal lenses so that we can see off in the distance and then also see up close. There's also a decrease in tears. That's important to know as we care for older folks. Quite often people need moisturizing of their eyes with eye drops, and making sure that those eyes stay moist as we age. One of the most common disorders found in the aging eye are cataracts. Cataracts is a clouding of the normally clear and transparent lens of the eye. Fortunately, there is good treatment for cataracts. We can have cataract surgery where they actually take out the lens of the eye and replace it with a artificial lens. And sometimes even they can correct vision at the same time that they do that. I had that done just a few years ago, and I was amazed at the difference in my ability to see things more clearly, but also that I was surprised at how more vivid colors were after I had cataract surgery, because again, that yellowing of the cornea as affects the lens, and you tend to see things again in a little bit more yellow tints with the artificial lens that they put in that was clear. It was amazing how much more vivid colors were. The nice thing about that cataract surgery also is that cataracts do not redevelop as you age once you've had that surgery. Another age-related eye condition is macular degeneration. the macula is located in the center of the retina. It's the leading cause of blindness in older adults. So remember, cataracts are the most common disorder of the aging eye, and macular degeneration is the leading cause of blindness in older adults. Symptoms are difficulty performing tasks, require close central vision. There are dark or empty areas in the center of the vision. You can't see color as well. And if you're going down the road driving, you might see like a kink in a telephone pole or a bend in lines on the road. Words on a page could be blurred. If you're looking at a grid, a part of the grid may look like it's malformed. It could be at any point in this grid, but that's one of the tests that they often use with checking for macular degeneration. Unfortunately, at this point, there's no known way to fix that like there is for cataracts. So who is this at age 80? Most of you probably can guess right away that this is Hillary Clinton. This is her at age 60 and at 80. She may look a little bit more like her picture of her at age 80 if she didn't have makeup, and because and hair color, of course. We do find that again, your lifestyle does affect the way that you age, and people with high-powered positions like Secretary of State or the presidency, those kinds of jobs age you more quickly. I think if you look at pictures of Obama before he was elected president, and now more recent pictures of him after serving in the White House, you'll see that there's quite a dramatic change. And every president, especially those serving 8 years, 2 full terms, the big change in the difference between their appearance before and after that. Okay, let's go on and talk about hearing. One of the major dysfunctions of the aging ear is presbycusis. It's a slow, progressive, bilateral, symmetric disease in hearing that primarily affects high tones. It's associated with aging. If you go into the module and click on the hearing test, in the lower right-hand corner of that website, you'll find tones that you can click on and listen for. And there are certain tones that those of you who may be 18 to 20 can hear, that those of you who are 25 to 30 may not be able to hear. There are tones that I can't hear. In fact, I can't hear any of the tones except for that last one that says age 60. Up to age 60. I have unusually good hearing, and so I'm able to hear that tone. My wife's not able to hear that. So we are all affected a little bit differently, but hearing loss begins at a pretty early age, again affecting those high tones first, and make it more difficult to hear. Something that we need to be aware of as we are caring for people with hearing loss is that our natural tendency is to talk louder when we talk to people with hearing loss. The problem with that is that our voice, the tone of our voice tends to go up as we talk louder. And that's just aggravates the situation. What we really need to do is drop the tone of our voice so we talk in as low a tone as possible. Slow down and talk distinctly and in lowered pitch. That seems to be the best way to talk to older folks and have them hear what we need them to hear. So who is this at age 71? Well, if you guessed Alicia Keys, you were correct. Here she is at age 28, and then compared to her at age 71. Smell and taste. There is some loss of taste and smell that occurs normally with aging, and it can have a significant impact on quality of life, primarily with nutrition, because food just doesn't taste as good, and loss of appetite is often a problem with older folks. So this one's, I think, one of the most difficult ones in past classes I've had, identifying this person at age 76. He plays for the New York Mets, and his name is Jose Reyes. A baseball fan may know who this is, but here's a picture of him at age 24, and you can see at age 76, and he looks pretty good for a 76-year-old. Again, I think the artist assumes that he's going to have a pretty good lifestyle, and as with Alicia Keys as well, and it's going to look pretty good at an older age. Now we're going to go on and talk about some of the changes that take place in musculoskeletal structure as we get older. There's a decrease in muscle mass, both the decrease in size and number of muscle fibers as we get older. There's a deterioration of muscle cell membranes and a degenerative change in arterial cartilage. So the cartilage that is really the shock absorber of our skeletal system begins to break down. There's also bone loss. All of these together create a situation where it's much easier to fall because of weakness, and combined with other things that happen to us as we age, and more likely that we're going to break bones when we do fall because of the bone loss. So here is Clint Eastwood at age 20-something, and a recent picture of him. He's in pretty good shape, but again, you can see that age does affect us, even when we try to keep ourselves in pretty good shape. Some of the negative functional consequences: we got loss of strength, loss of balance, bones break easier, we have pain through muscle and skeleton. People become shorter, 1 to 3 inches, and taller people tend to lose more height than shorter people. Okay, association with the musculoskeletal system, we have a lot of people have arthritis. It's a nearly universal, slowly progressive degenerative condition affecting both men and women, also known as degenerative joint disease. And again, the breakdown of the cartilage, it affects the way in which our bones relate to each other, and can be quite painful as we get older. And again, we need to be aware of these things because we need to make sure that we create environments where any trip hazards are taken care of. Make sure that floors are clear of throw rugs and those kinds of things that we can trip on. Make sure that they're clear of any kind of trip hazards. I always checked our sidewalks every spring when I worked as a nursing home administrator. Checked the sidewalks around the facility to make sure that there was no heaving done during the wintertime that caused one sidewalk to be a little higher than the other, again causing a possible trip hazard. And then I would have the maintenance guys go out and grind those down if there was any of those kinds of situations. So arthritis causes joint pain, stiffness, loss of motion, decreased function, even deformity. You might see some people in their hands, their fingers maybe look bent in an odd, may go off in an odd direction. a big concern with all of these changes is that we have an increased number of falls. Again, in long-term care, typically we have accident committees, accident incident committees, where we review all of the accident incident reports, making sure that if there is an accident, we investigate it and make sure that we remove any hazardous situations that may occur. If there's any way that we can prevent a fall, we try to do that. Some of the intrinsic factors is just increased age, functional impairment, dizziness, poor balance, weakness, depression, chronic illness, risk-taking, and surprisingly, there are a number of older folks who are will take risks. Something that I've realized as I get older, I'm 65, or will be 65 this year, is that yes, my first experience getting old. As with all people, this is quite often a new thing for us. We haven't, and we don't realize the limitations until sometimes it's too late. I've seen older folks, stepping up onto a chair that may be somewhat wobbly, and then up onto a counter to reach something, when they really shouldn't be doing that at their advanced age, but quite often they do. One time I was working in a retirement community and responded to an alarm. And when I arrived, there's two women sitting on the floor, and one of them had broken her leg, and the two women were sisters, and the one sister had bet the other sister that she could no longer hop up and down on one leg as they used to when they were young, and she said, yes, I can still do that, and she jumped up and down on one leg, fell and broke her leg. It's not that uncommon to see older folks taking those kinds of risks. Okay, so this is a pretty familiar face lately in politics. Donald Trump at age 61 and at age 70. So, cardiovascular changes. We have stiffening of the vasculature, the veins and arteries, thicker, less elastic, more dilated veins. There's an increase in heart rate. There's an increase in peripheral resistance, higher blood pressure. The non-modifiable risk factors are age. Just as we age, this happens. Gender, men tend to have more dramatic and negative effects than women. And our family history. Some people just have good family genes that they're inherited, and you can't really change that. Modifiable risk factors, you can take medication and try to have some, through your lifestyle, make some changes to your high blood pressure or hypertension. Smoking has a negative effect on the risks that we take, especially in the cardiovascular area, and body weight also has an effect. So there's some things we can do to keep ourselves healthier longer, even given our family history, our gender, and our age. Of course, the risks are heart attack and stroke. So here's another baseball player, probably someone that you can identify, recently retired from baseball, and Derek Jeter at age 33, and then at age 74. Again, I think the artist assumes he's going to continue a pretty healthy lifestyle as he gets older. Okay, respiratory changes. There are age-related changes, decreased elasticity of lung tissue and a weakening of respiratory muscles. which means that we spend more energy just breathing as we get older. There's a decrease in gas exchange, so the oxygen we take in is not used as efficiently, and as we exhale, we don't exhale as much carbon dioxide. There's a diminished cough reflex, so if we do have something in our lungs, it's harder for us to cough to get those out. And there's because of that, we have an increased susceptibility to respiratory infections, because we can develop pneumonia, inhalation. Pneumonia, I believe, is a type of pneumonia that's caused by, again, breathing in something that we just can't get out of our lungs. Elimination. We also have a decrease in bladder capacity. There's a relaxation of the pelvic floor muscles, so we have less control. We tend to have an incomplete bladder emptying, and urinary urgency and frequency. And this is a huge issue in long-term care. In the nursing home, I typically spent up to $100,000 of our budget every year with incontinence supplies. For a 113-bed facility, my budget typically was right around $100,000. So, significant amount of money being spent there, and it's a huge problem, both in terms of just the practical side of that, but also in terms of emotional privacy issues. People don't feel very good about having this particular problem. It's more emotionally impacting than some of the other changes that take place as we get older. Sleep is affected. We have a harder time falling asleep. We're awake more often during the night, and we have to spend less time in deep sleep. Now, some of you might think, well, no, I know that I know a number of people who fall asleep quite easily. They're in their easy chair, and we're even in a conversation, they may just nod off and fall asleep. And a lot of elderly people do that, but they're not really, falling asleep in a good deep sleep at night. They're actually sleep deprived, and that's why they tend to nod off during the day, because they're not getting that good night's sleep. So, who is this at age 80? This person is a person I think the artist thinks is going to have a maybe not as healthy a lifestyle as she gets older. And that would be Paris Hilton. Here she is at age 27 and at age 80. So, again, we all age. These changes take place as we get older. It's important for us to know just for our own personal lifestyle, but it's also important to know as caregivers of elderly people that we need to accommodate the aging body in our environments of care. So that ends the lecture. Well, I hope you have a good day.